पैलेटेबल वे, है ना. जितने भी आपके जितने पिछले सालों से जितने भी इम्पोर्टेंट टॉपिक्स आते जा रहे हैं, we definitely teach those in class. So it's kind of a very good way to do all your important topics as far as physiology is concerned. ठीक है. So क्लास नोट्स पे ज़रूर क्लास में जो पढ़ाया जाएगा उसके ऊपर ज़रूर ध्यान दीजिए. ठीक है. क्लास नोट्स बनाइए. And it's always very, though of course we will give you a workbook as well. You will get a workbook, but I still feel that खुद जब आप अपने क्लास नोट्स बनाते हो तो that is a very easy way to remember things, है ना. Because when you're writing your class notes, you're listening to us, you're seeing what is written, you are hearing, so there is so much of input, sensory input which goes into making your class notes. So class notes is actually the best way to retain information, right? Now, the other thing that I would always suggest is do MCQs. You must go into a question bank and dedicate 2 hours every day for MCQs, right? So make it a point that you definitely start doing your MCQs, right? Now, you're just starting, right? So today is of course a demo class, so that means कौन से MCQs करें, कौन से particular subject के करें, या particular, how do we go about it? So here I would suggest is going to the app. सबसे पहले एक GT कर लें, pick up a previous GT, grad test. Just do it. I know you've not studied anything, and why am I asking you to do a grad test? And why am I? The reason why I'm asking you to take a grad test is, you understand what is a grad test, na? It has got all the subjects, all the questions from all the 19 subjects. Okay? So, all right. Okay. All right. So all the 19. So grand test is basically all the questions from all the 19 subjects. So why am I asking you to take a grand test right now is because grand tests have it's a very good way to assess where you stand right now. Even though you've not started studying, but still it's a very good way to assess where you stand. Okay? Plus, you'll be able to also get a brief idea about which is your strong subject, which is a weak subject, which are the weaker subjects, and which are the stronger subjects. Idea मिल जाएगा. Probably when you are taking the grand test, आपको पता चलेगा कि yes, pharmacology is not as strong as I want it to be, or maybe biochemistry is not as strong. So you'll be able to identify. Huh? And plus, another very important benefit of taking a grand test is that you come to know what kind of questions are being asked. Okay. Of course, the performance may or may not be very good, but doesn't matter because अभी तो पढ़ाई शुरू भी नहीं की है. This is just a sort of a before and after वाला होता है ना. So this is kind of a before assessment, a pre-assessment before you actually start studying. Okay. Then, as we go along, since we are preparing for the mid-year FMG. As we go along, I would always recommend that every 15 days take a grand test. Okay? Every 15 days, and towards the end, last 2 months, every 10 days. Okay? This is a good way to see how are you performing. Okay? So what have we spoken about up to now? The class tests. Number 2, I said grand tests. Number 2, I said MCQs. MCQs have to be done everywhere. Class notes, class में जो पढ़ाया जाएगा. Number 2, your MCQs, and number 3, grand tests. These are 3 things that I've spoken about. Okay? Now, as far as your physiology class is going to be concerned, all right. Now, as far as physiology class is concerned, so I'll take on a few important topics which were asked this year in the FMG. Okay? We can do that, right? So let's see. आप अभी आ रहे हो, so we are doing a sort of a demo, right, for 2 hours, right? Okay. So what I'll do is I'll pick up some कौन सा chapter करना चाहोगे? Anything? Sir, general physio से सीधा या CNS से कुछ पढ़ा दूँ? Demo है तो फिर हाँ CNS से कुछ पढ़ा दूँ? हाँ ठीक है, चलिए. So CNSA I will take up, and we've also got students watching us on YouTube. All right. So any suggestions from students on YouTube also you could possibly give us. and I will. All right. So see, let's do a little bit about the tracts. There are a lot of questions which are asked from sensory tracts and motor tracts, and very important from medicine point of view also. So let's do the ascending tracts. Ascending or the sensory tracts. जितने आपके sensory tracts होंगे, are you all comfortable with my Hindi English mix? ठीक है कि सिर्फ English नहीं, सिर्फ Hindi and English mix is fine? You want only English?
No, it's fine,
It's okay. You're able to follow, right? Okay. All right. So let's see which is the ascending or the sensory tracts, right? Now, when I say ascending tracts, now these are the ones which are going to carry sensory information from the periphery to the sensory cortex. Sensory cortex. ये आपके ascending tracts है ना? There are three major divisions of the sensory tracts, and these are number one, the posterior column. Posterior column, जिसको हम बोलते हैं dorsal column. Dorsal column, medial, lemniscal pathway, right? Dorsal column, medial, lemniscal pathway, right? The posterior columns are also known as dorsal column, medial, lemniscal pathway. Then you have what is known as the spinothalamic tracts. Spinothalamic tracts, and then you have what are known as the spinocerebellar tracts. Okay? Now the important question which is asked from this is कि कौन सा tract कौन सी information को carry करता है, ठीक है? Now when I look at the posterior column, this is meant for finer sensations, right? More evolved sensations, which are more recent in terms of evolution. जैसे posterior column is meant for fine touch, right? Fine, well localized touch, ठीक है? उसे कहते हैं fine touch, right? Fine, it is meant for fine touch. It is meant for localization, vibration, 2-point discrimination, 2-point discrimination, conscious proprioception. Conscious proprioception. अब proprioception का क्या मतलब होता है? What is proprioception? Proprioception is joint and position sense. ठीक है? That is called proprioception. Now, for instance, जैसे आपको पता है कि you're sitting on your bench, the table and chair, तो आपकी hip joint is semi-flexed, knee joint is semi-flexed, ठीक है? What is the position of your elbow? Again, semi-flexed. You are aware of this. This is called conscious proprioception. Proprioception मतलब position sense, what you are aware of. ठीक है? आपको पता है, you know what is the position of each joint, each muscle. That is called conscious proprioception. Then what else is carried by the posterior column is what is known as stereognosis. What is stereognosis? Stereognosis किसे कहते हैं? The ability to detect an object by feeling its size and shape. That is called stereognosis. Yeah? Ability to detect an object by feeling its size and shape. Do you remember how did we test for stereognosis? Sensory system examination में आप stereognosis को कैसे test करते हो? आप अपने patient को कहते हो कि आंखें बंद करिए. उनके हाथ में you place some familiar object. And he feels the size and shape of the object and tells you this is a pencil or a pen. Have you understood? That is called stereognosis, right? Have you understood? So you place something, you ask him to close his eyes and place some object on his hand. He feels the size and shape and tells you what that is. That is called stereognosis. ठीक है? तो ये हो गया आपके posterior column. Posterior column क्या carry कर रहा है? Fine touch, localization, vibration, 2-point discrimination, कॉन्शियस प्रोप्रियोसेप्शन एंड स्टीरियोग्नोसिस. ठीक है, अब आते हैं स्पाइनोथैलेमिक ट्रैक्ट्स पर. स्पाइनोथैलेमिक ट्रैक्ट्स, देयर आर टू टाइप्स ऑफ स्पाइनोथैलेमिक ट्रैक्ट्स. एक है लैटरल स्पाइनोथैलेमिक ट्रैक्ट और दूसरा है एंटीरियर स्पाइनोथैलेमिक ट्रैक्ट. Lateral spinothalamic tract is meant for pain and temperature. Pain and temperature. These are your these are carried by the lateral spinothalamic tract. अब जो anterior spinothalamic tract है ये क्या क्या कैरी करेगा? This carries crude touch, itch, tickle, sexual sensations, right? Crude touch, itch, tickle, sexual sensations. Have you understood? So these are all carried by the spinothalamic tract. आप अगर नोटिस करें हमने अभी तक प्रेशर की बात नहीं की है. प्रेशर कौन सा ट्रैक्ट कैरी करता है? ठीक है. So now pressure has got a dual transmission. Barognosis. Now what is baro? Baro is pressure. Gnosis is detection. So detection of pressure is done by the anterior spinothalamic tract. Have you understood? Barognosis is detection of pressure. This is done by the anterior spinothalamic tract. And posterior column क्या करेगा? Posterior column carries ability to detect different degrees of pressure. This is carried by the posterior column, right? Ability to detect the different degrees of pressure is carried is by the posterior column. Have you understood, right? So you've got lateral spinothalamic tract and the anterior spinothalamic tract. Anterior spinothalamic tract barognosis के लिए है, detection of pressure के लिए है, right? And posterior column is for ability to detect different degrees of pressure. Is that clear? Right? अब आते हैं spinocerebellar. Spinocerebellar. नाम से क्या पता चल रहा है कि it is from the spinal cord till the cerebellum, right? And now spinocerebellar tracts. There are different types of There are 4 major types of spinocerebellar tracts. These are meant for unconscious proprioception. Unconscious proprioception. मतलब क्या? What is unconscious proprioception? Proprioception is position sense. Now position sense which reaches the cerebellum is something which you are not aware of. Have you understood? देखो cerebellum का जो major function क्या है? Cerebellum का major function है coordination, motor planning और coordination, movements की coordination. ठीक है? अब जैसे आपने एक bottle लिया, when you have to open the cap, it is a very well coordinated movement, है ना? तो कोऑर्डिनेशन सेरेबेलम का फंक्शन है वो, लेकिन कोऑर्डिनेशन कब कर पाएगा? अगर उसे हर एक स्मॉल मसल ऑफ द हैंड, हर एक जॉइंट की पोजीशन उसको पता होगी, है ना? तो जो प्रोप्रियोसेप्टिव इनपुट सेरेबेलम में जा रहा है वो हो जाता है अनकॉन्शियस प्रोप्रियोसेप्शन. मतलब इट इज नॉट समथिंग यू आर अवेयर ऑफ, इट इज रीचिंग द सेरेबेलम. सेरेबेलम उस इंफॉर्मेशन को यूज करेगा फॉर कोऑर्डिनेटेड एक्टिविटी, फॉर कोऑर्डिनेशन ऑफ मोटर एक्टिविटी, लेकिन यू आर नॉट अवेयर ऑफ इट. What you are aware of, which reaches the cortex, और वो कौन सा ट्रैक लेके जाएगा? Cortex, the conscious proprioception. बोलिए, conscious proprioception कौन लेके जा रहा है? Posterior column. ये देखो, conscious proprioception is by posterior column. Unconscious proprioception is by the spinocerebellar tract. Have you understood? Unconscious proprioception इसलिए क्योंकि वो cerebellum तक जा रही है. कॉन्शियस प्रोप्रियोसेप्शन क्योंकि वो कॉन्शियस ब्रेन विच इज योर कॉर्टेक्स वहां पर जा रहा है. हैव यू अंडरस्टूड? सो अनकॉन्शियस प्रोप्रियोसेप्शन बाय स्पाइनोसेरेबेलर ट्रैक्ट एंड कॉन्शियस प्रोप्रियोसेप्शन बाय द पोस्टीरियर कॉलम. इज दैट क्लियर? ठीक है. एक और मेरा क्वेश्चन आंसर कीजिए कि अगर एक पोस्टीरियर कॉलम का लीजन है, अगर एक पोस्टीरियर कॉलम का लीजन है तो barognosis प्रेजेंट है कि एब्सेंट है? बोलो. दिस इज गोइंग टू बी प्रेजेंट. क्यों? क्योंकि barognosis कौन कर रहा है? Anterior spinothalamic tract. Anterior spinothalamic tract. Have you understood my point? Posterior column केवल ability to detect different degrees of pressure. Is that clear? ठीक है, तो ये हो गया आपका what is carried by the different tracts. Okay with that, right? अब आते हैं, let's have a look at how do these tracts move upwards. ठीक है, let's see how do these tracts move upwards. जैसे सबसे पहले हम posterior column की how do they go upwards. ठीक है, let's try and do that. ये midline है, ठीक है, दिस इज द मिड लाइन है. यहाँ पे मैंने एक क्रॉस सेक्शन ऑफ स्पाइनल कॉर्ड बनाया. ठीक है, ये है बटरफ्लाई शेप्ड ग्रे मैटर. ये डॉर्सल रूट है. डॉर्सल रूट में एक डायलिटेशन होती है जिसका नाम है डॉर्सल रूट गैंग्लियन. ठीक है, और ये आपकी एंटीरियर रूट है. दोनों मिल के बनते हैं स्पाइनल नर्व. ठीक है, अब देखिएगा, सबसे पहले आपको समझना होगा कि फर्स्ट ऑर्डर सेंसरी न्यूरॉन क्या है. विच इज द फर्स्ट ऑर्डर सेंसरी न्यूरॉन? दिस इज समथिंग नोन एज द DRG सेल. DRG स्टैंड्स फॉर डॉर्सल रूट गैंग्लियन सेल. डॉर्सल रूट गैंग्लियन सेल. अब इसका क्या मतलब हुआ? ये हमारा फर्स्ट सेंसरी न्यूरॉन है. ठीक है, फर्स्ट सेंसरी न्यूरॉन इज द डॉर्सल रूट गैंग्लियन सेल. इसका मतलब हुआ दैट द सेल बॉडी ऑफ द DRG सेल lies in the dorsal root ganglion. Have you understood? There is a dorsal root, there is a ventral root, together they form the spinal nerve. So dorsal root has a dilatation which is called dorsal root ganglion, और इसमें जो सेल होगा जिसमें that is known as a dorsal root ganglion cell. अब ये यूनिपोलर है, सूडो यूनिपोलर है, बाइपोलर है या मल्टीपोलर है? इसका क्या मतलब होता है? यूनिपोलर का मतलब हुआ ये सेल बॉडी है, एक प्रोसेस है. यूनिपोलर सिंगल प्रोसेस. सूडो यूनिपोलर इज कि लगता है कि उसका एक प्रोसेस है बट है एक्चुअली दो. बाइपोलर क्या हुआ? जिसके दो प्रोसेसेस हैं. ठीक है, और मल्टीपोलर क्या हुआ? जैसे ये एक न्यूरॉन है, इसके मल्टीपल प्रोसेसेस हैं. समझ आ रहा है? ठीक है, यूनिपोलर सिंगल प्रोसेस. यूनिपोलर न्यूरॉन्स फीटल लाइफ में होते हैं. आफ्टर बर्थ यू डू नॉट सी यूनिपोलर न्यूरॉन्स, तो ये तो भूल जाइए. ठीक है, सूडो यूनिपोलर का मतलब क्या हुआ? सूडो मतलब फॉल्स. लगता है कि एक प्रोसेस है, राइट? लगता है कि एक प्रोसेस है बट एक्चुअली है दो. Have you got my point? That is pseudo unipolar. ये है आपका DRG cell. DRG cell is a pseudo unipolar neuron. Pseudo unipolar neuron. Have you got my point? Right? Pseudo unipolar neuron. Bipolar neurons, auditory neurons होते हैं, vestibular neurons होते हैं. आप लोग करेंगे बाद में स्पेशल सेंसेस में, स्पेशली आपको ये बाइपोलर न्यूरॉन्स. मल्टीपोलर न्यूरॉन्स, ये वाले जो मल्टीपोलर न्यूरॉन्स हैं, मोस्ट न्यूरॉन्स आर मल्टीपोलर. ठीक है, लेकिन ये जो DRG सेल है ये कौन सा है? बोलिए. सूडो यूनिपोलर. यूनिपोलर न्यूरॉन्स तो फीटल लाइफ में होते हैं, उसके बाद होते ही नहीं है. सो सूडो यूनिपोलर न्यूरॉन. लगता है कि उसका एक ही प्रोसेस है, लगता है कि वो इस तरह से एक ही प्रोसेस है, लेकिन होते उसके दो हैं. एक जो पेरिफेरी की तरफ जाता है और दूसरा जो स्पाइनल कॉर्ड की तरफ. अब होगा क्या? जैसे हमने एक स्किन के ऊपर किसी तरह का स्टिमुलस दिया, मे बी फाइन टच, मे बी वाइब्रेशन. हैव यू अंडरस्टूड? सम स्टिमुलस हैज बीन गिवन इन द on the periphery, on the skin. So in pulses there is an action potential which is going to be generated here. एक action potential generate होता है ना? This you know that, isn't it? When a receptor is stimulated, it will generate an action potential. Yes? And now this action potential will travel via the peripheral process, then via the central process into the spinal cord. Right? यहाँ पर आपने let's say fine touch दिया, then the impulse will travel via the peripheral process first, then via the central process, and it reaches the spinal cord. ठीक है? This is, let's say, like I said, let's say this is fine touch. Fine touch is carried by बोलो posterior columns. ठीक है? Now this central process, it enters into the posterior part of the spinal cord and ascends upwards. ठीक है? Ascending tract है. अब ये ascends upwards. Make sense? ठीक है? कहीं कोई synapse नहीं है. इसका जो central process है बहुत ही लंबा central process है क्योंकि इसका पहला synapse कहाँ पर होगा? The first synapse is in the medulla. The first synapse is going to be in the medulla, and what is this nucleus which is known as the nucleus gracilis and nucleus cuneatus. Nucleus gracilis and nucleus cuneatus. These are both located in the medulla. This is where you have the first synapse, right? Nucleus gracilis and nucleus cuneatus, and from here arises what is known as the second order sensory neuron, right? You have what is known as the second order sensory neuron. First order sensory neuron कौन सा था? बोले DRG cell. किस तरह का न्यूरॉन था? Pseudo unipolar. इसका central process enters into the spinal cord, ascends upwards. First synapse कहाँ पर है? Medulla में. मेडुला से अब कौन सा सेल अराइज करेगा? सेकंड वाला. साइनैप्स होगा तो सेकंड अराइज करेगा. नाउ दिस सेकंड ऑर्डर सेंसरी न्यूरॉन इट क्रॉसेस ओवर टू द ऑपोजिट साइड. सो माय नेक्स्ट इंपॉर्टेंट क्वेश्चन, क्रॉसिंग कहां पर हो रहा है? क्रॉसिंग इज एट द लेवल ऑफ मेडुला. हैव यू अंडरस्टूड? एंड दिस विल गो टू द ऑपोजिट साइड थैलेमस, राइट? It will go to the opposite side thalamus, and what is the nucleus of the thalamus? This is called the ventero-posterolateral nucleus, also known as the ventero-basal complex. Ventero-posterolateral nucleus or the ventero-basal complex. So this is where you have the second synapse in the thalamus. अब यहाँ से कौन सा न्यूरॉन अराइज करेगा? बोलो. Third order sensory neuron. तीसरा वाला. सेकेंड साइनैप्स यहाँ पर है, यहाँ से तीसरा वाला अराइज करेगा. एंड दिस थर्ड ऑर्डर सेंसरी न्यूरॉन गोज इनटू द सेंसरी, बोलो, कॉर्टेक्स. ब्रेन तक जाएगा. ठीक है? फिर से एक बार देख लेते हैं. लेट्स ट्राई एंड सी दिस. So the first order sensory neuron, which is the first order sensory neuron? First order is the dorsal root ganglion cell, right? Dorsal root ganglion cell, this is a pseudo unipolar neuron. So when I give a sensation, any sort of a stimulus on the skin, it is perceived by the receptor. There is an action potential which is generated. It will go via the peripheral process, via the central process, into the posterior part of the spinal cord, ascend upwards. First synapse will be in the medulla, nucleus gracilis, nucleus cuneatus. From here arises the second order sensory neuron, crosses over to the opposite side, goes to the opposite side thalamus, and the nucleus is called ventero-posterolateral nucleus or the ventero-basal complex. And from here, the third order sensory neuron will arise, which goes to the sensory cortex. ठीक है? अब सवाल उठता है, अब इसको हमने डॉर्सल कॉलम मीडियल लिम्निस्कल पाथवे क्यों कहा? क्योंकि ये क्रॉस करने के बाद बन जाता है व्हाट इज नोन एज द डॉर्सल. दिस द डॉर्सल कॉलम बिकम्स द मीडियल लेमिनिस्कस. क्रॉस करने के बाद ये जो फाइबर्स हैं ये बन जाते हैं व्हाट इज नोन एज द मीडियल लेमिनिस्कस. हेंस इट इज ऑल्सो नोन एज द डॉर्सल कॉलम मीडियल लेमिनिस्कल पाथवे. इंपॉर्टेंट पॉइंट, कौन सा न्यूरॉन क्रॉस कर रहा है टू द ऑपोजिट साइड? सेकेंड ऑर्डर सेंसरी न्यूरॉन, है ना? और कहां पर क्रॉस कर रहा है? लेवल ऑफ विच लेवल? स्पाइनल कॉर्ड, मेडुला, ब्रेन? मेडुला. हैव यू अंडरस्टूड? राइट. अब ये जो सेंसरी कॉर्टेक्स है इसके बारे में थोड़ा सा लेट्स हैव अ लुक. ठीक ये सेंसरी कॉर्टेक्स कहाँ पर है? नाउ व्हेन यू लुक एट द, इस तरह से है ना, familiar diagram, right? Now there is a central sulcus, right? तो एक gyrus होगा जो central sulcus के सामने है, which is called the precentral gyrus and postcentral gyrus, right? So which is the sensory cortex? Sensory is precentral, postcentral. बोलिए, ये हो जाएगा postcentral. The postcentral gyrus is known as the sensory cortex. Postcentral gyrus is known as the sensory cortex. Precentral motor होता है, ठीक है? इसको कहते हैं areas 3, 1 and 2. Brodmann's areas. Brodmann ने classify करे हैं. He's given numbers to different areas, right? So sensory cortex is known as areas 3, 1 and 2. And in the postcentral gyrus, you also have what is known as the sensory homunculus. What is sensory homunculus? Sensory homunculus क्या है? There is a complete map of the body in the sensory cortex, right? There is a complete map of the body in the sensory cortex. मतलब the entire body is represented in the sensory cortex. लेकिन जो representation है in the cortex, it is not proportional to size. Have you understood? जितने areas which are more sensitive, they will have a larger cortical representation. बताइए, which are the areas which are more sensitive? Which are the areas which are more sensitive? Hands, fingers, very sensitive areas. Face, very sensitive area. Yes? So this has a larger cortical representation. Right? So what happens, what is a sensory homunculus? Sensory homunculus क्या है? Like I said, this is a map of the whole body. Right? लेकिन this map is not proportional to size. Right? So this is more sensitive areas have larger cortical representation. Right? More sensitive areas have larger cortical representation. This is what is known as a sensory homunculus. Larger, more sensitive areas, like for instance, for example, very large representation for, very large areas for, बोलिए, for hands and fingers, right? Face, including lips are also very sensitive areas, right? So all these, अब देखिए, लेकिन जैसे trunk है, trunk, back, these are not very sensitive areas. तो इनकी जो representation होगी वो comparatively small होगी. Have you got my point? So this is how it is post-central gyrus. This is your sensory cortex. Have you understood? Have you got my point? Right? तो ये हो गए आपके posterior column. ठीक है, फाइनल सेंसेशन सब पोस्टीरियर कॉलम के थ्रू जा रहे हैं. तो इसी तरह हम स्पाइनोथैलेमिक ट्रैक्ट को भी देख लेते हैं. ठीक है, सो लेट्स सी हाउ डज द स्पाइनोथैलेमिक ट्रैक्ट असेंड अपवर्ड्स. बिल्कुल उसी तरह से आई विल ऑल्सो डिस्कस द कोर्स ऑफ द स्पाइनोथैलेमिक ट्रैक्ट. इसी तरह से वी विल मेक अ क्रॉस सेक्शन ऑफ द स्पाइनल कॉर्ड. Posterior root ganglion, anterior root. So the first order sensory neuron, like I said, is the DRG cell, unipolar neuron, pseudo unipolar neuron, right? Looks as though it has one process, लेकिन इसके बोलिए दो processes हैं. बिल्कुल जैसे आपने देखा ना posterior column में. यहाँ पर भी first order sensory neuron is the DRG cell, dorsal root ganglion cell, pseudo unipolar. ठीक है, important points. This is a pseudo unipolar neuron. Now when I give a stimulus on the skin, Which are the sensations carried by the spinothalamic tract? Anterior spinothalamic tract, crude touch, itch, tickle, sexual sensations, and barognosis. Lateral spinothalamic tract, pain and temperature. ठीक है? So one of these, if I give this stimulus on the skin, action potential arise करेगा. ये action potential जाएगा via the peripheral process, via the central process into the spinal cord. बिल्कुल जो आपने posterior column के साथ देखा था. ठीक है? लेकिन एक बड़ा डिफरेंस, और वो ये है कि पोस्टीरियर कॉलम का जो फर्स्ट साइनैप्स था दैट वाज मेडुला, बट हियर द फर्स्ट साइनैप्स विल बी इन द डोर्सल हॉर्न itself, right? So where is the first synapse? First synapse will be in the dorsal horn, either at the level of entry, at the level of entry into the spinal cord, or 1 to 2 levels above, right? Either at the level of entry into the spinal cord or 1 to 2 levels above. यहाँ से अब arise करेगा आपका सेकेंड ऑर्डर सेंसरी न्यूरॉन. ठीक है, देख लीजिए पोस्टीरियर कॉलम में कौन सी सेंसेशंस, स्पाइनोथैलेमिक ट्रैक्ट में कौन सी सेंसेशंस. वी ऑलरेडी डिस्कस दैट. दोनों में अब एक और मेजर डिफरेंस क्या आता है. फर्स्ट साइनैप्स पोस्टीरियर कॉलम का मेडुला में है, यहाँ पर स्पाइनल कॉर्ड में ही है. ठीक है, तो सेकेंड ऑर्डर सेंसरी न्यूरॉन डोर्सल कॉलम में अराइजेस फ्रॉम द मेडुला, बट फ्रॉम हियर इट अराइजेस फ्रॉम द dorsal horn itself, either at the level of entry into the spinal cord or 1 to 2 levels above. ठीक है, अब यहाँ से ये जो सेकेंड ऑर्डर सेंसरी न्यूरॉन है, इसका प्रोसेस क्रॉस करके it travels in the lateral part of the spinal cord and ascends upwards. Make sense? ठीक है, it ascends upwards and it now reaches the थैलेमस. कौन सा थैलेमस? सेम साइड थैलेमस, ऑपोजिट साइड थैलेमस? ऑपोजिट साइड थैलेमस. Ventero-posterolateral nucleus, or also known as the ventero-basal complex. ठीक है, it goes to the opposite side thalamus and यहाँ से अब arise करेगा third order sensory neuron, which will go into the सेंसरी कॉर्टेक्स. ठीक है, तो अगर हमने अगर एक पेन का स्टिमुलस हमने हैंड पे दिया है, इट विल गो वाया द फर्स्ट ऑर्डर सेंसरी न्यूरॉन इनटू द स्पाइनल कॉर्ड, फिर वहाँ से सेकेंड ऑर्डर सेंसरी न्यूरॉन, फिर स्पाइनोथैलेटरल स्पाइनोथैलेमिक ट्रैक्ट, इट विल गो टू द सेंसरी कॉर्टेक्स, बट विच एरिया? हैंड वाला एरिया. वहाँ पर it will go to the hand area of the sensory cortex, जहाँ पर आप फिर आपको वो पेन perceive हो जाएगी. Have you understood my point? So this is what is meant by the spinothalamic tract. ठीक है, और sensory cortex कहाँ पर है? We've discussed this, pre-central, post-central. Post-central gyrus, and this is areas 3, 1 and 2. Okay with that? ठीक है? समझ आ गया? ठीक है, अब now going back to the posterior column, let's try and understand what is the organization of the fibers in the posterior column. ठीक है, मतलब किस तरह से, आपको पता ही है कि जो major divisions हैं, you can see sacral fibers, lumbar fibers, thoracic and cervical. ठीक है, अब देखिए ये इसको थोड़ा समझने की कोशिश कीजिए, बहुत इंपॉर्टेंट है. अब जैसे ये जो posterior column है, as it ascends, it is an ascending tract. It is carrying fibers to the cortex. So fibers will keep joining the tract, right? So that means this tract will be thickest in which area? Sacral area या cervical area? Cervical area. ठीक है? So that means fibers keep adding on. They just keep. So if I take a cross section of the spinal cord at the sacral level, only sacral fibers are present. Move upwards, I take a cross section of the spinal cord at the lumbar area. Now lumbar area में, now lumbar fibers have come and joined the tract, but these fibers will be lateral to the sacral fibers. पहले सिर्फ sacral fibers थे, फिर lumbar area के fibers join करते हैं. So they will be placed lateral to the sacral. Move upwards, thoracic fibers will join. Now they will join lateral to lumbar. So if I take a cross section of the spinal cord at the cervical area, I find that which fibers will be placed medial most? Sacral. Okay? Lateral to sacral will be lumbar. Lateral to lumbar will be thoracic, and lateral most will be cervical. Have you understood? और ये जो sacral and lumbar fibers हैं, इनका नाम है fasciculus gracilis, और thoracic and cervical fibers का नाम है fasciculus cuneatus. Remember C for cervical, C for cuneatus. ठीक है? और इनको कहते हैं tracts of Gall and Burdach. Gall and Burdach were two very famous physiologists जिन्होंने ये tracts को define किया था. ठीक है? Have you understood? So tracts of Gall and Burdach, these are gracilis and cuneatus. Sacral and lumbar fibers is fasciculus gracilis. Right? How I tend to remember it, कि L lumbar और gracilis में भी L आता है, and cuneatus, C for cervical, C for cuneatus. So the thoracic and cervical fibers will be fasciculus cuneatus. ठीक है? अब एक बड़ा इंटरेस्टिंग सा क्वेश्चन समझ आ गया ये fasciculus gracilis and fasciculus cuneatus. Yes? एक बहुत इंटरेस्टिंग सा क्वेश्चन आंसर कीजिए कि there was a question which was asked that which tract is specific for stereognosis. Remember I said what I told you what is stereognosis? You ask your patient to close his eyes and you place a familiar object and ask him to identify. So generally you identify familiar objects with your hands. Right? So tell me tract which is specific for stereognosis. Fasciculus gracilis या fasciculus cuneatus? Cuneatus. क्यों? क्योंकि hands are used. Hands के fibers कौन से होते हैं? Thoracic and cervical. Have you understood? Right? So your fasciculus cuneatus is going to be the tract which is specific for, ठीक है? This was a question which was asked. Tract which is specific for stereognosis will be, बोलिए, fasciculus gracilis या fasciculus cuneatus? Fasciculus cuneatus. ठीक है? But ये मतलब नहीं है कि fasciculus gracilis does not carry stereognosis. वो भी करता है. लेकिन जो tract specific है for stereognosis, that is going to be fasciculus cuneatus. Isn't it? See, another common example of stereognosis I can give you. For example, sometimes what happens is when you're sitting in class or when you are listening to a lecture, you tend to remove your shoes or your chappals or your sandals, whatever you're wearing, right? Now, when you want to get up, you're looking or you start feeling for that chappal or the shoe, right? What are you trying to do? That is also stereognosis. You are trying to locate your slipper and trying to put it on, right? So that is going to be carried by fasciculus gracilis because lower limb fibers are lumbar and sacral, है ना? लेकिन जो tract specific है for stereognosis, that is hand वाले fibers. That is going to be fasciculus cuneatus. C for cervical, C for cuneatus. Have you got my point? Have you understood this? ठीक है? अब आते हैं, ये तो हो गया आपका posterior column में fibers की how are they positioned. अब spinothalamic tract. Now spinothalamic tract में एक major difference क्या हो गया है between the posterior column and the spinothalamic tract? What is the major difference? In the case of the posterior column, ये जो tract बन रहा था, this is formed by fibers which have not yet crossed. क्योंकि जाके कहाँ cross करते हैं? Medulla में. लेकिन spinothalamic tract कैसे बनता है? This is formed by fibers which have already crossed. They've crossed and then they form the tract which goes up to the thalamus. So there's going to be a difference in the organization of the fibers. So what do we find here? Now this is the lateral spinothalamic tract. We find, now again this is an ascending tract. Now fibers, when they cross, and they will join the tract, fibers will cross and join the tract. So as we move upwards, fibers will keep joining on the medial side of the tract. So that sacral fibers here will be pushed lateral most. Medial to sacral will be lumbar, medial to lumbar will be thoracic, and medial most will be cervical. Have you understood? The fibers are crossing and then forming the tract. So as you keep going upwards, fibers will keep crossing and joining the tract, and so fibers from the upper part of the body will be placed medially, unlike the posterior column. Have you understood my point, right? The lateral spinothalamic tract is meant for pain and temperature. Anterior spinothalamic tract, same organization. Sacral, lumbar, thoracic, cervical. Again, it is a lateral to medial arrangement here. ठीक है? समझ आ रहा है? ठीक है? Now this has got a very important clinical implication. Let's try and understand that. What is the clinical implication here? See, ultimately, what is the point of doing physiology is also to help you understand medicine, right? So let's try and understand a very important clinical implication here. We all know about spinal tumors. Spinal tumors, and there are two major ways to classify spinal tumors, right? Two major divisions. एक होता है medullary spinal tumors और दूसरा होता है extramedullary spinal tumors. What are medullary spinal tumors? They arise from the spinal cord itself. Extramedullary spinal tumor means from outside the spinal cord. It could be from the meninges, for instance. Have you understood? Right? So spinal tumors can be classified into two types. You've got medullary and the extramedullary. पहले extramedullary लेते हैं. Let's say extramedullary. And the medullary spinal tumors. Okay? Now supposing there is an extramedullary spinal tumor arising from outside the spinal cord. Okay? Now as this tumor enlarges, tell me which fibers will be affected first? पहले sacral fibers, फिर lumbar, फिर thoracic, फिर cervical. So ये आपको patient कहेगा that there was loss of pain and temperature first in his lower limb, then maybe his trunk, and then maybe his upper limb. Does it make sense? Which fibers are getting affected? First the sacral fibers, then lumbar, then thoracic, then cervical. So he gives you, this patient will give you a history of. This patient will give you a history of a ascending loss of pain and temperature. It is called ascending sensory loss. It is an ascending loss of pain and temperature. Have you understood what I mean by that? He's saying पहले उसको he could not feel the pain in his foot, then maybe his leg, then the thigh area, and then probably later in his hand. Ascending sensory loss हो रहा है क्योंकि पहले sacral fibers affect हो रहे हैं, फिर lumbar, फिर thoracic, फिर cervical. ठीक है ना? लेकिन अगर हम एक पेशेंट कह रहा है रिवर्स, उसको लॉस ऑफ पेन टेम्परेचर पहले हाथों में हुआ, अपर लिम्ब में हुआ, फिर ट्रंक एरिया में और फिर लोअर लिम्ब में, प्लीज राइट, फिर लोअर लिम्ब और पैर में. सो दैट मीन्स दैट इज ए डिसेंडिंग सेंसरी लॉस, राइट. सो डिसेंडिंग सेंसरी लॉस कैसे होगा? अगर ट्यूमर इज अराइजिंग फ्रॉम विद इन द स्पाइनल कॉर्ड, मेड्यूलरी ट्यूमर है, तो जैसे ये एनलार्ज होगा तो पहले कौन से फाइबर्स अफेक्ट हुए? सर्वाइकल, देन लंबर, देन थोरैसिक एंड देन sacral. Sorry, पहले सर्वाइकल, फिर थोरैसिक, फिर लंबर, फिर sacral. So that means there is a history of बोलो. Descending sensory loss. So if there is a clinical scenario, if you are able to get this typical history, that there is a history of descending sensory loss or ascending sensory loss, समझ आ गया? Have you understood? Descending का मतलब हुआ पहले he says pain का sensation उसके हाथों में उसे कम feel हुआ या नहीं feel हो रहा है, फिर upper limb और फिर lower limb and last में foot is got affected also. Or reverse order will be called ascending sensory loss. So medullary spinal tumor है तो history of a descending sensory loss. Extramedullary spinal tumor है तो it is a history of. So अगर इस तरह की history मिल रही है तो even without doing an MRI, you can actually be able to give an idea about what sort of a tumor is it. Have you understood, right? So that is the importance of history taking, है ना? कॉलेज में बोलते थे ना, history बहुत अच्छे से लो, ठीक है? तो history taking बहुत important हो जाती है. Have you understood my point, right? So ये हो गए आपके posterior column and the spinothalamic tracts, ठीक है? Now let's also have a look at the descending tracts, ठीक है? Since you joined in a little later, we are just doing some topics from different random topics. It's a demo class today, right? So we're doing random topics, and I've picked up CNS, the tracts first, and then I'll do something else, maybe from CVS or from RESP or something. Okay? Okay. All right. So let's have a look at the descending or the motor pathways. Ascending कौन से थे? Sensory थे. अब descending हो जाएंगे motor. ठीक है? Descending or the motor pathways. Because why are they called motor? Because they're going to carry information now from the cerebral cortex to the spinal cord and to the muscles. Have you understood? So orders for movement come from the brain, from the cortex, isn't it? So this is going to be descending or the motor tracts or the motor pathways. Now these descending or the motor pathways, they are divided into there are two major divisions, two major types. एक है medial descending tracts, एक है medial descending tracts और दूसरे हैं lateral descending tracts, right? Medial descending tracts and the lateral descending tracts. Now medial descending tracts are meant for what is known as the axial muscles. Medial descending tracts are meant for axial muscles, muscles which control the axial skeleton. Okay? These are meant for tone and posture. Tone and posture. The lateral descending tracts, these are meant for control of distal muscles, just as small muscles of the hand. And these are meant for fine, skilled movements. Fine, skilled movements. ये जो distal muscles हैं, जैसे small muscles of the hand, these are involved in fine skill. ये जो आप लिख रहे हैं, ये बहुत ही fine skilled motor activity है. हाथों को use करते हैं for very fine motor activity, isn't it? And that is done by the lateral spine. उनका control is going to be by the lateral spinothalamic tract. Now the lateral descending tracts, like I said, जो major tract है, जो fine skilled movement को control करता है, that is, sorry, not spinothalamic tract, lateral corticospinal tract, or also known as the pyramidal tract. Lateral corticospinal tract or the pyramidal tract. This is the major tract which is meant for fine skilled movements. The second is what is known as the rubrospinal tract. Rubro, red nucleus. Rubro is red. This arises from the red nucleus in the midbrain to the spinal cord. This is called rubrospinal tract, which is also known as the alternate. This is known as the alternate. Bolo? pathway. देखिए जो मेजर ट्रैक्ट कौन सा है? मेजर ट्रैक्ट कौन सा है? Lateral corticospinal tract, pyramidal tract जिसे कहते हैं. This is the major tract which is meant for fine scale movement. ठीक है? फिर देखिए medial tracts कौन से हैं? जो टोन एंड पॉस्चर को कंट्रोल करते हैं. ये जो इरेक्ट पॉस्चर है उसको कंट्रोल करते हैं. सबसे पहले आता है medial corticospinal tract. Vestibulospinal tract, tectospinal tract, and number 4 is what is known as the reticulospinal tract. Reticulospinal tract. ठीक है? ठीक है? Medial corticospinal tract, vestibulospinal tract. Vestibulospinal tract का क्या मतलब हुआ? From the vestibular nuclei in the medulla to the spinal cord. Tectospinal tract from tectum to the spinal cord. Reticulospinal tract from reticular formation to the spinal cord. ठीक है? And ये जो reticulospinal tract है, this is divided into two. There is a pontine or excitatory reticulospinal tract, and there is a medullary or inhibitory reticulospinal tract. ठीक है? Are you okay with that? Reticulospinal tract दो है, एक pontine tract है. Reticular formation आपको पता है ना कहाँ होता है? What is reticular formation? Reticular formation is a collection of neurons. It's a collection of cell bodies. बहुत ill-defined area है in the brainstem. That means medulla में है and extends right up to the midbrain. Right? So उसका एक pontine area है, medullary area है. There is a pontine reticulospinal tract which is excitatory and a medullary reticulospinal tract which is inhibitory. Have you understood? और ये muscle tone को control करता है. Muscle tone क्या होती है? You know what is muscle tone ना? Muscle tone is the state of partial contraction of the muscle at rest. That is called muscle tone. है ना? How do we know what is muscle tone? For example, if your elbow is extended, right? Triceps is contracted, biceps is relaxed. Biceps जब contract करती है तो flexion होती है. Triceps जब contract करती है तो extension होती है. So when the elbow is extended, if you feel the biceps is not flabby. There is a certain degree of contraction of the biceps, even if it is at rest. That is called muscle tone. So pontine reticulospinal tract is called excitatory or facilitatory tract. तो इसका मतलब ये muscle tone को बढ़ाएगा या कम करेगा? बढ़ाएगा. और medullary reticulospinal tract is known as an inhibitory tract. So that means ये muscle tone को कम करेगा, right? So ये pontine or the excitatory tract will increase the muscle tone, and the medullary or the inhibitory tract will decrease the muscle tone. Have you got that point? Right? So these are your medial descending tracts and the lateral descending tracts. ठीक है? अब इनको भी हम follow करेंगे. इनका भी अब course follow करते हैं from above downwards. Sensory tracts को हमने follow किया था from below upwards. इसको अब above downwards से follow करेंगे. ठीक है? अब ये जो tract है, again I'm going to draw the midline. Now this tract will arise from, where does this tract originate from? तो पहले वो करते हैं. पहले origin of the tract देखते हैं. Origin of the, कौन सा tract मैं कर रही हूँ आपके साथ? Corticospinal tract. ठीक है? So it is going to be from the primary motor cortex. Primary motor cortex. Which is the primary motor cortex? This is the precentral gyrus. Precentral gyrus. That means the part of the, this is the area. in front of the central sulcus. ठीक है, उसको कहते हैं प्री सेंट्रल. पोस्ट सेंट्रल क्या था? सेंसरी. ये प्री सेंट्रल क्या है? मोटर. ठीक है. So pre-central gyrus. This is also known as area, Brodmann's area 4. सेंसरी थे क्या? कौन से? ये 4 है, यहाँ था 3, 1 and 2. ठीक है. प्राइमरी मोटर कॉर्टेक्स में भी एक मोटर होमंक्यूलस है. एक मोटर होमंक्यूलस, जैसे आपने एक सेंसरी होमंक्यूलस किया था, यहाँ पर भी एक मैप ऑफ द बॉडी है, which is called the motor homunculus. Yes, sensory homunculus में क्या था? I told you that more sensitive areas have got larger cortical representation. But in the motor homunculus, what is going to happen? More complicated movements. Movements which are more complicated movements have larger cortical representation. Right? More complicated the movement, larger is the cortical representation. Tell me, which is the most complicated movement? बताइए. Which are the ones which you think which will have a very large cortical representation? Number one is muscles of vocalization. Muscles of vocalization have a very large cortical representation. ये जो speech है, हमारी speech involves the muscles of larynx, tongue, facial muscles, ये सब involved हैं. तो ये बहुत ही complicated voluntary activity है. So it has got the largest cortical representation. Have you understood? Then you have muscles of mastication, swallowing, chewing food. Chewing food, mastication is a very complicated motor activity. Again, a large cortical representation. Then muscles of hands and fingers. These also have a large cortical representation. ठीक है. जितनी complicated movement होगी उतनी ज्यादा cortical representation होगी. एक आसान सा question मेरा आंसर कीजिए. Which of the following has the largest cortical representation? Muscles of the shoulder, elbow, wrist or fingers? सबसे complicated कौन सा है? किसकी movement सबसे complicated? Wrist की तो इतनी है बस. Fingers, thumb की बहुत complicated. So which is the one which is going to have the largest cortical representation? Fingers. Isn't it? ये देखिए, ये जो opposing thumb है, ये केवल humans कर सकते हैं. Thumb की भी एक बहुत large representation है, thumb और fingers की. Have you understood? ये सिर्फ humans कर सकते हैं. कोई जानवर और नहीं कर सकता है ना? Have you understood my point? So this is your muscles of vocalization, mastication, and muscles of hands and fingers will have a very large cortical representation. Then second is, now remember, primary motor cortex gives rise to just 30% of the fibers. 30% of the fibers of the corticospinal tract arise from primary motor cortex. Then you have premotor and supplementary motor areas. Premotor and the supplementary motor areas. This is area 6. This contributes 30% of the fibers. 60%